Coronary artery disease, also called CAD, or heart disease, happens when the blood vessels that bring oxygen and nutrients to your heart get blocked. This blockage is usually caused by cholesterol and plaque. When your heart doesn't get enough oxygen and nutrients, you might feel chest pain, discomfort, tightness, or trouble breathing. If the blockage isn't treated, it can lead to a heart attack. Sometimes doctors need to use special procedures, like stenting or bypass surgery, to help fix it. If you have CAD, or if you've had a heart attack, stenting, or bypass surgery, your doctor probably prescribed you some medications to take. This video will explain the most common medications used for people who are living with CAD. Understanding why these medications are prescribed and how to take them can help you use them correctly and watch for any possible side effects. Taking your medications regularly, as prescribed, is one of the most important things you can do for your heart health. They help your heart heal and get stronger, and research shows they can lower your chance of having another heart problem. While all medications, prescribed and over-the-counter, can have side effects, research shows that the benefits outweigh the risks. There are 5 types of medications that are usually prescribed if you've had a heart attack or bypass surgery. These are 1. Anti-platelet medications. 2. Angiotensin-converting enzyme inhibitors, or ACE inhibitors. 3. Angiotensin receptor blockers, or ARBs. 4. Beta blockers. 5. Statins. Before we talk about each type, it is important to know that many medications have 2 names, a brand name and a generic name. This can be confusing. To help you keep track, make sure you have an updated list of your medications with both names. You can keep this list in your phone, wallet, or purse. Anti-platelet medications stop certain blood cells, called platelets, from sticking together and forming clots. Examples of these are aspirin, also called acetylsalicylic acid, or ASA; clopidogrel, also called Plavix; ticagrelor, also called Brilinta. These medications are very important if you have CAD. You might need to take 1 or 2 of them. Usually, you'll take one of these medications for life. If you are taking 2, one of them might be stopped 1 to 3 years after your heart event, depending on what your doctor decides. There is no special monitoring required for antiplatelet medications. It is common to notice some bruising, but serious bleeding is rare. If you do experience bleeding, talk to your doctor or get medical help right away. Angiotensin-converting enzyme, also called ACE inhibitors, are medications with names that end in pril, like ramipril. Angiotensin receptor blockers, also called ARBs, are medications that end in sartan. like candesartan. These two types of medications work in similar ways. If you have CAD, you are likely on one of them. You should not be on both types at the same time. Here's why these medications are used. 1. They help lower your blood pressure. So, it is a good idea to check your blood pressure regularly. If it gets too low, or if you feel lightheaded or dizzy, contact your cardiac rehab nurse. 2. They help the heart muscle recover after an injury. You may be prescribed this medication, even if your blood pressure is normal, to help your heart in the long run. 3. They've been shown to lower your risk of another heart event. We usually start these medications with a low dose and then slowly increase if you're feeling okay. If you do well on them, you might need to take them for life. These medications are cleared from your body by your kidneys. It's rare, but they can sometimes affect how your kidneys work or change your electrolyte levels. After your dose is increased, you should have your blood checked. ACE inhibitors can also cause a dry cough. If you develop a dry cough, contact your cardiac rehab nurse to talk about it. Beta blockers are medications that end in LOL, like bisoprolol, metoprolol, and carvedilol. Here's why these medications are used. 1. They slow down your heart rate, which is also called your pulse. This helps your heart relax and pump better. It's a good idea to check your pulse regularly when you're resting to make sure it's in a normal range. A healthy adult heart rate is 60 to 100 beats per minute. For people with CAD, we often aim for a lower heart rate, sometimes in the 50s. 2. They also lower blood pressure, which helps your heart pump more easily. It is a good idea to monitor your blood pressure to make sure it is at the right level. 3. These medicines can help your heart muscle recover if there has been any damage. If you have had a heart event, you might have had an echocardiogram, which is an ultrasound of your heart, to check for damage. We usually start these medications at a low dose and gradually increase them if you're feeling okay. If these medications are working well for you, you will likely need to take them for life. These medications can cause low heart rate or low blood pressure. As a result, some people feel lightheaded or dizzy, and others may feel tired. Another potential side effect is erectile dysfunction, which is difficulty starting or maintaining an erection for males. If you notice any of these side effects, talk to your doctor or nurse. Lowering your cholesterol is very important in CAD. Learn more about the targets for cholesterol and the medications used to treat it in our cholesterol video. The main medicines for high cholesterol are called statins. Examples include atorvastatin, rosuvastatin, simvastatin, or pravastatin. Research shows that statins help lower LDL, the bad cholesterol, and triglycerides. They also help reduce plaque in the arteries, which lowers your risk of having a heart attack or stroke. After starting a new cholesterol medicine or changing the dose, you should have your cholesterol levels checked in 2 to 3 months. Cholesterol medications are usually taken long-term. Statins are processed by your liver, and in rare cases, can cause damage to your liver. They can also cause muscle or joint aching. If you experience side effects, talk to your doctor. These are the 5 main medication types used for CAD. Depending on your needs, you might also use other medicines, like those for angina, high blood pressure, or lowering cholesterol. You can learn more about the other heart medications in a different video. Your pharmacist is also a great resource if you have any questions about your medications. Taking your medications properly is very important for your health. Here are a few tips for taking your medications safely. Always keep a current list of your medications with you. Bring your medications to every medical appointment, and let your doctor know if anything changes. When you travel, keep an updated list with you. And put your medications in your carry-on luggage. Taking your medications exactly as your doctor tells you is really important. Your doctor, nurse, or pharmacist can help you set up a good schedule for taking them. There are many reasons why people may not take their medications as prescribed. Perhaps you don't feel well or are experiencing side effects. If taking medications is new for you, it helps to make it part of your regular routine. You might need to set reminders for yourself. If paying for your medications is a problem, please let your nurse or doctor know. There is a lot of information online about medications. Some of it is good information, and some of it is not. If you have questions about your medication, it's best to speak with your medical team or pharmacist. If you're having any issues or concerns, be sure to follow up with your doctor, nurse, or pharmacist. We want you to feel well and confident with your medications.